We're talking about something today that affects some 65 million Americans and can cause some real complications. We're talking about hypertension with Dr. Purvi Mehra from eStudy Site. Good morning. Good to see you.
It's nice to see you.
Hypertension, 65 million Americans, that sounds like a pretty big problem.
It is a big problem. Hypertension, which is also known as high blood pressure, is exactly that. It's a condition where the pressure of the blood in your body is elevated, primarily in the vessels that go from your heart to the rest of your body, known as your arteries.
So the heart is having to work extra hard.
Right.
There's extra pressure going on here. That has what kind of bad effect then?
Well, it can affect the arteries, of course, because they're constantly getting slammed with this high blood pressure. And the organs with the smallest and finest arteries in your body are the most susceptible to having the damage.
Kidneys?
Kidneys, the eyes. You can have blindness. You can have kidney failure leading to dialysis. And then, of course, the damage to the heart. Constantly pumping against this high pressure can lead to heart wall thickening, which is known as hypertrophy. And then, on another topic, hypertension is a major risk factor for heart attack and stroke, which are big killers in this society.
So there's really no good side to hypertension then, in other words. So there's every reason to get it under control.
It's true.
Okay, how do we get it under control? Well, how do we diagnose it first? Because are there necessarily symptoms?
Well, unfortunately, a lot of people, up to 30% of people with mild to moderate high blood pressure, never have any symptoms of it. And this can be a problem because you can think, well, if I'm not feeling bad, it can't be hurting my body. Right. But actually it is. For people who do have symptoms, they're kind of broad, they're vague. You can feel confusion, you can feel fatigue, you can feel anxiety, blurred vision, ringing in the ears, headache. So it's not a very specific symptom, it's just kind of a lot of general things.
So you need to have your blood pressure checked, obviously, on a regular basis by your doctor. Once you're diagnosed, what do you do?
Well, there are some things you can do, which are the first things we recommend, which are lifestyle modifications. And those go in line with the things that we consider a good, healthy lifestyle. So if you smoke, you should quit smoking because smoking tobacco independently raises blood pressure. If you're overweight, losing a few pounds, especially in the abdomen, can help. Having a well-balanced diet, having aerobic exercise, limiting your alcohol, all of those things can help considerably.
If those things do not work, though, and you still have high blood pressure, then you resort to the drug therapies. How are we doing on those?
That's right. You know, a lot of people, in spite of all of those things, will still require medications. And there's 6 or 7 classes of medications that work very well. Now, your doctor will have to decide which one of those would be best for you, because if you have another condition like diabetes or heart problems, one of the medications could be better than the others.
I would imagine then that there would be some clinical trials going on most of the time, then, because this is such a big problem.
There are a lot of clinical trials that take different types of patients, and for more information you can visit us at eStudySite.com to see if there are any clinical trials currently running that you could participate in.
Very good. eStudySite.com. Dr.
Right.
Purvi Mehra, it's great to see you.
It's nice
Thanks
to see
for being
you.
with us.
Thank you.